Well, good morning, everybody. I am Katie Karras. I'm the District Safety Administrator. I see a lot of familiar names here, but for those that don't know me, I am the Department Head for the District Safety Office. I also lead the District 4 Safety Team, and I'm a Target Zero team member. So I'm very excited about the safety culture we've been building in District 4 since I've been in my role for 3 years or so. And this is the next big step that we're taking in the district. So District 1 created a safety academy. We've heard about it for the last couple of years. And we've been asking to see if we can go statewide. So Kittleson has been supporting the state safety office and making a statewide version of a safety academy. And our district is the district that's getting to pilot it. And you chosen few, you 30 that are selected by your department heads are the ones that are granted the opportunity to be part of this pilot. So I would just say bear with us a little bit. You know, this is the first time these slides have been put together and the first time they've been presented. And we're very excited. Tracy and I are going to help facilitate. So the state safety office consultants are going to bring, you know, the state perspective and perhaps just perspectives from other districts they've been part of. And then Tracy and I can facilitate. Tracy's our district safety engineer, from any district perspectives or answer any questions that we might need to handle from that technical side. So yeah, thank you all for participating and being here today and spending the next, you know, this 10 virtual sessions and then an in-person one. So with that, I think we'll just go in order of team's alphabetical last name, probably the easiest for introductions for DOT staff. So Silvana, and then we'll just, you know, go down from there.
Hi, good morning, everyone. My name is Silvana Alvarez. I'm a roadway designer. I'm in section 2.
Good morning, Kate. This is Fernando Ascanio from the Environmental Office.
Hey, good morning. It's Rob Boscham with the Design Office and the Consultant Management Group.
I think it's Kelly next. I know it's hard if you didn't see your own name.
Sorry, my bad. Kelly Voodoo Plimo.
Okay, I think I'm next. Lois Bush. I'm also in Plimo Policy.
Claudette's here. She may just be listening in. So Claudette's from OM.
I'm here, Katie. I was able to rearrange my schedule.
Oh, look at you. Thank you.
Yes. Claudette de los Santos. I'm in OMD, and I'm the bike ped coordinator.
Hello, Alexander Diepa, roadway design.
Hello, Actus Etienne, roadway design, section 1.
Kadian?
Oh, sorry. Kadian Foster, OMD Seaport.
Good morning, Harold Gonzalez, Modal Development Rail Administration.
Good morning, Lori Harari, Plimo Policy and Mobility Planning.
Good morning. I'm Angie Udiel from Traffic Safety Section.
Great. And then Stephen or Stephen?
Your mic might be muted, looking physically.
Good morning, Christine Earlhawk, Planning System Analytics Group.
All right, we'll jump to Greg.
Yes, good morning. This is Greg Jett. I'm in Design Section 3.
Mackinson.
Hi, good morning. I am in Section 1 and House Design.
I think we'll go to.
I'm next.
Sure.
Yeah. Good morning, Billy Scott, in-house roadway design.
Brad Salisbury, Design Project Manager for Design. Jamie Polidora. I'm design liaison for Treasure Coast Operations.
Stephanie?
Stephanie Quintana, Office of Modal Development, Passenger Operations, Moto Planner.
Good morning, Jose Ramirez, Roadway Design, Section 3.
Good morning, Carla Rios, Plimo Concept Development Group.
Good morning, Trang Bang, Project Development, Plimo Group.
Good morning, Robert Vader, Drainage Department.
Good morning. This is Hazel Sosa, Project Development Manager here at Plimo. My computer is acting up doing one of those reboots, so I'll turn on my camera when it comes back.
No worries. And I know we all have cameras on now because of DOT policy, but we may need to start turning them off if we have any bandwidth issues. And then Tracy and then whoever else that might have got missed.
Is it my turn? Because I cannot see the order.
Yeah, yeah. We'll jump into you.
Right. Okay. Okay. Good morning, everyone. I'm Tracy, she's District Safety Engineer. I'm here to facilitate the Safety Academy, and I'm happy to answer any question you may have during the training. And specifically, if that's the question, for specific. And thank you for your passion and enthusiasm to improve safety. I definitely saw it's a big commitment for all of you go through all the 10 modules. I hope you enjoy it.
And I don't know if anybody was missed, if you want to jump and introduce yourselves, otherwise we'll go to Kittleson. And then I think I'll just be in the background listening. Thanks.
This is Rupert Giroux, State Safety Office.
All right. Is that all DOT? All right, so we'll have Brianna and Ryan introduce yourselves, and with my introduction, we'll get started.
Hi, everyone. My name is Brianna Teska. I work for Kittleson. I'm actually located in Pennsylvania, but I've worked on several DOT trainings before. I'll be here monitoring the chat, and I'll be able to turn my camera on. Similarly to others, I've been having some computer problems this morning.
And good morning, I'm Ryan Cunningham, also with Kittleson. I work closely with the State Safety Office. I'm located in our Orlando office. Do a lot of work with District 5 and have done some work around the state as well, with District 4 included.
And good morning, my name is Nathan Kautz. We'll be delivering this presentation. We'll have a few other people tap in for some of the others, but this morning it'll be me. So a little bit about my background. I started with the department as a PE trainee. Went through, specialized in construction, stayed in construction for a number of years as a project administrator, and they had project oversight at that time. And then one day someone reached out from traffic ops, like, hey, we have this position in access management. We think you should go for it. So went into access management. That was my introduction to traffic engineering. Went through access management, was the district traffic services program engineer for a while, and then before I left, I was the district traffic safety program engineer. We were part of the vital few at that time, and then since leaving the department, been working on a number of different safety oriented contracts, a lot through the SS4A program, as well as working with Ryan and Rupert and the central office safety contract. So this is the basic Traffic Safety Academy. So let's talk a little bit about what the Academy is and what we're trying to get out of it. So the idea behind the Academy is kind of a holistic approach to solving safety issues on our projects. It was kind of the idea of everyone's a safety specialist. When it was beginning to be developed at that time, the safety group is primarily responsible for safety outreach and education, as well as managing the work program funds. They're usually smaller groups that couldn't hit everything in the department. So there was a need at that time for additional training for people that were coming into technical positions that maybe didn't have that background or had not been exposed to this type of information before. So that goal was to be able to walk people through kind of the same approach that Tracy's using on a day-to-day basis, and being able to understand how to solve safety problems, what the safety problems are, where to get crash data, for instance, and then finally at the end of the academy, be able to do a workshop. So making sure we put this on paper, we're going to understand what our mission is in the department. We're going to understand how to find and use the data, understand what our top 3 emphasis areas are, how to solve the top 3 emphasis areas, and then finally demonstrate mastery in a hands-on exercise. There are, it ends up working out to 10 modules plus a workshop. So we're going to do the introduction today. We're going to talk a little, today is going to be broken down into understanding what we're facing and kind of what our mentality is going into it. We're going to get into different types of safety analysis, spot treatments, systemic versus best practices versus standards, what's nominal versus substantive safety. We're going to talk a bit about the safe system approach, determination of countermeasures, like kind of what's our thought process when we're doing it. One of the ideas and philosophies we're going to be talking about is that countermeasures are great and we need to be doing it, but if we get it into the project in the first time, before a safety issue occurs, then they're design features, right? We want to get to the root cause and the source of the problems instead of trying to treat the symptoms later. I apologize if I cough. I'm getting over a cold. Then we'll get into how to perform a crash evaluation, intersection safety, bike ped safety, and lane departure, which are 3 emphasis areas we'll talk a little bit more about. Speed calming and speed management. This is a high priority, basically because speed calming is a cross-cutting measure. It affects everything. Talk about how to perform safety field reviews. And then on the final day, we're going to meet in the D4 auditorium. We're going to do a little bit of a debrief or a briefing beforehand, hand out some papers. And then we're going to meet in the field, do a field review, then come back. And after lunch, we're going to get together and we're actually going to walk through those projects and figure out how to solve the safety issues that we're seeing from the crash data, as well as our field observations. So drilling down a little bit more into today's conversation, try to answer what the problem it is that we're facing today. Get into target zero. Target zero, as you are probably very well aware of, is the state of Florida's approach to this, what the safe systems approach is, and a little bit about what FDOT is doing. I imagine a number of folks have seen this slide or similar slides. So we have 36 people in this chat, right? If we look at this slide, we are losing more than that every day. So essentially this entire chat, everyone here could be in a severe accident and it still would not get to the level that the state of Florida is experiencing every day. I think we start to accept some of the risk because we're exposed to driving every day. But when we consider the fact that these are people's families, there's real people, it starts to become a very real issue. So looking globally, 1.25 million people lost every year from traffic crashes, almost 43,000 on US roads in 2021. And then in terms of pedestrians, almost 7,400 in the US in 2021. How are we doing? So these are slides largely addressing our strategic highway safety program. It's a little bit of light reading, so if you ever want like a cozy Sunday afternoon, curl up with a tea and the strategic highway safety plan, highly recommend it. It's great reading. But anyways, what it does is it lays out the problems that the state of Florida is specifically facing, and then overarching strategies for trying to prevent those problems. So we're looking at 2015 to 2019, right? And we're seeing there's 2 trends that we're seeing, right? We're seeing a decrease in serious injury, but an increase in fatalities. And we're not quite sure why that's happening. The decrease in serious injury, it could be, I mean, we could be doing very well in some of our campaigns. If you think about it, we have the Alert Today Alive Tomorrow campaign. We have a number of different coalitions. ICE has become a lot more prevalent. We're getting a lot more safer intersections installed. The Complete Streets policy was adopted, and some of those projects are starting to get through the work program and being built around this time. And even like traffic ops and ITS and our managed roadways, looking at faster response times and less secondary accidents. In terms of crashes increasing, we do have a prodigious growth rate in Florida. Larger vehicles are part of the issue. There's an energy transfer there with larger vehicles that you can't get around. Humans are fairly fragile, and that causes it. So if we fast forward from 2019 to what today looks like, we're still seeing a drop in serious injury, but we're still seeing the increase in fatalities. We are finding that we are being successful in some places, but there's still a lot of work to be done. The COVID era was really bad, right? So one of the things that was happening in the COVID era with less people on the roadways was that speeds were going up. And this is one of the reasons why we're going to have as a later module. When people started getting back on the roads, speeds really haven't gone down appreciably. So we're seeing a lot of those spikes due to the speeding related instances. So when a crash occurs, right, it's a kinetic energy transfer. And the equation for kinetic energy is 1/2 mass times velocity squared. So there is a parabola relationship with speed, right? You square it. It's very influential on how much energy is transferred to the crash. Headlines like this: we were third most dangerous nationally. And then you can see some of our trends that we've seen in data played out with FHP, where they're responding to fewer crashes, but there's more fatalities. Once again, a lot of the theory behind this is vehicle size, but primarily speed. Speed is it contributes to a higher likelihood sometimes of getting crashes, but really what it does is when the crash happens, it significantly increases the likelihood of a severe injury or fatality. So this is the cover of the Strategic Highway Safety Plan. FDOT has a commitment to improve safety. We have a belief that we can reduce and eventually eliminate fatal and severe crashes. Trying to address every crash is, at this point, probably a little bit prohibitive. So what we want to do is focus our resources on the ones that make a devastating impact in somebody's life or their family. There's an effort to align the organization with safety as the primary goal. We've heard it with the Vital Few, and now with the Compass Initiative, we're centered on communities with safety as a priority. And the idea is that every person is a safety expert. We want to make sure that we are not relying on others to take care of safety analysis and looking after it. We each have ownership in it. So if we're in construction, we're making sure that what's in the plans for safety is getting built. If we notice, say if we're in construction or maintenance and we notice there's a safety issue, we're letting someone know and we're doing what we can to fix it. If we're in design, we're working with our project manager, with our consultant PMs, or if you're in design yourself, making sure that stuff's in there. If you're in PD&E, working with a predictive method. Every job is a safety job. We are all responsible for doing it. Zero is our call to action. The only way this works is for every person in their jobs to focus on eliminating fatal and severe injury crashes. One thing that I like to ask myself is, if I was held personally responsible for reducing or eliminating fatal and severe crashes in 10 years, what would I do differently in my job? When I was in the safety program engineer position, what jobs would I program? What would I advocate for? What decisions would I make if I was held responsible for making that happen? And when you start looking at it through that lens, you start to see little pieces where maybe we would do something differently, where maybe we prioritize, say, scope and schedule, or we would start making those decisions and start focusing on that zero being the ultimate goal. So when we look at a strategic highway safety plan, there's a number of emphasis areas. With roadways, we have lane departures and intersections, road users, pedestrians, aging road users, motorcyclists and motor scooter riders, commercial motor vehicle operators, trucking, teen drivers. Recently, central office has worked on an aggressive driving campaign for young males, basically identifying them as an emphasis area and a place where we can try to start driving some of the speeding issues down. User behavior, impaired driving, occupant protection, speeding and aggressive driving, and distracted driving. That is one thing we'll get into with the Target Zero initiative, is that user behavior is a significant component of it. I would like to say and encourage you, when you're looking at infrastructure projects, not to look at those 4 emphasis areas as only user behavior issues, right? We can look at speeding and aggressive driving. We can't necessarily stop people from being aggressive completely, but we can work on it, right? We can do speed calming measures. I would encourage you, I'm going to volunteer Rupert for a minute. Rupert is an industrial engineer by education. Have a conversation with Rupert. Industrial engineers, by and large, are designing their facilities to work with people, whether it's assembly lines, whether it's a structure. It's designing around the human element to get people to do what they want through design and discourage behaviors we don't want through design, instead of necessarily educating people, because you can't necessarily educate someone every time they enter your building, right? Drunk driving, for instance. I've seen a lot where it's, hey, they were drunk, there's nothing we can do. It's not entirely true, right? Assuming that the person's not passed out, drunkenness generally leads to an impairment of function. So the same things that the same countermeasures that you would use for any other emphasis area where someone perhaps lacks judgment or lacks ability are still somewhat effective. If you think about, like, say, a pedestrian, let's look at lighting, for instance. If you're a drunk driver, reaction time is significantly decreased. And so not that we're trying to make it safer to do that, but at nighttime, if you have sufficient lighting, the ability to see cars way ahead and be able to extend the required reaction time for the person can help. If you're dealing with pedestrians under the influence walking out into traffic, lighting is once again another really good example of allowing the driver's time to react to the pedestrian. So when it comes to user behavior, I just want to encourage people, we are working on user behavior change campaigns for that, but also know that what you do with infrastructure matters as well. And then we're seeing some involving emphasis areas: work zones, drowsy and ill driving, rail crossings, roadway transit, micromobility, the electric scooters that you see everybody using, and then connected and autonomous vehicles. Our top 3 emphasis areas. So these are the big ones. These are the ones that we're talking about in the introduction to the academy, right? Lane departure, bike bed, and intersection crashes. 9 out of 10 fatal crashes and 3 out of 4 injury crashes involves one of these areas. So when we talk about being efficient with our resources and our time and going after the lower hanging fruit, these are the crashes that we're talking about, right? Before I go on and get a little bit more in depth with these, I want to take a pause real quick and see if anybody had any questions about what we've covered so far. Okay, great. Oh, sorry, go ahead.
Just a quick question. What do you mean by ill driving? Is it what it sounds like it means, that people shouldn't?
Yes. So it goes back in. It's kind of like the idea of drunk driving, right? There's a reduction in function of the person and how well they can operate. So, if I am, I talked about being sick. So, last week, and it was really hitting hard. And you've got cold medicine, you're not really feeling like you are able to engage with the roadway. There was a time when I was in FDOT similar with drowsy driving, and our organizational safety person came in and told us that, hey, we could stop the state car and take a nap on the side of the road if we were sleeping. It was well thought out. It was well intended, but it maybe in execution didn't work out. But it's that idea. And I do see that Ben has his hand up. I think he has some more to add to it.
Yeah, just briefly, this was added as we were finishing out the planning for this version of the Strategic Highway Safety Plan. Policy planning brought up the possibility of ill or tired driving, and we added that as not an emphasis area, but an area of focus to see so we could study what the trends were.
Awesome. So to keep moving, I also want to say too, if you do have a question, you don't want to ask it out loud or you want to do it while we're moving, we are monitoring the chat. So feel free to drop something in there. We, either our team, Katie and Tracy are there, as well as Ben and Rupert. We'll find someone to take care of you. So lane departure represents 34% of all crashes, but 42% of all deaths. This is vastly overrepresented, right? From 2015 to 2019, it's a very similar pattern to what we were seeing before. Decrease in serious injury, increase in fatalities. So before we get on, I do want to ask a quick question too. Who can define what a lane departure crash encompasses for me? I just need one volunteer. That's not Ben or Rupert.
Sure, isn't it when a crash leaves the roadway?
Part of it is. So lane departure is when you leave the actual lane, right? So that can include side swipes. That can include leaving the roadway. It can also include head-on crashes when you're crossing the center line. All right. So if we look at what we're doing now, that 2019 to 2023, we're seeing the trend is still there. So we've actually went from 34% of all crashes that have 42% of all deaths to 32% of crashes with 44% of all deaths. The share of these crashes is increasing. Severe injury is decreasing. Fatalities are still increasing. This is one of the ones we'll get to when we have one of our focus modules where we've done a root cause analysis. But to go back to that definition, it's anytime you are leaving your lane, whether it's leaving the roadway, crossing the center line, improper passing, someone can leave the roadway at one side, overcorrect, and shoot over to the other side, but it's leaving the intended roadway that you're in. When we look at the Strategic Highway Safety Plan, some of the overarching principles, speed management, like I said earlier, is a cross-cutting measure. Looking at curve delineation, high friction surface treatment, horizontal curve design, rumble strips, eliminating the vertical drop-offs at the roadway pavement edge. That particular one works with that overcorrection. There's a lot more, but these are just kind of one of the ones we're acknowledging that engineering plays a pivotal part in what we're doing. So with intersections, 27% increase in fatalities and a 4% decrease in serious injuries. We still see the same trends, right? Serious injury going down, fatalities going up. A lot of this is conflict management within the intersections. We've adopted the ICE process. Some of the things that we're going to see when we start going through this or when we start looking at the work program and safety in the future, is that when we make a policy, just remember it takes time to go from the planning stage through the design phase, through construction. You've got to get through the work program before you actually start to see the effects. So some of the decisions that we were making years ago are finally starting to be built. District 1 has done a lot of after studies recently, and we're seeing that a lot of these projects, like roundabout projects, R-cuts, things like that, are significantly reducing fatality and fatal and serious injury crashes. So we are making progress on it. We need to see things catch up. The trend continues. 13% decrease in serious injury, 13% increase in fatality. Engineering, looking at traffic control improvements, intersection sight distance and lighting improvements, geometric improvements, and looking at making sure we are using the intersection control evaluation everywhere. We've adopted it, even in permitting. Florida Administrative Code 1496 has made it a requirement for certain levels of permits that it's now a required methodology to use when looking at intersection improvements. Changes are happening. Pedestrians account for more than 22% of the traffic fatalities in Florida. So if we look at that, right, 22% versus 44% of lane departures being fatalities, or being 44% of fatalities being lane departure. But we think about what the user representation is. more urban areas, there are a little bit more pedestrians generally, but still, when we're going down the road, think about how many cars are actually on the road versus how many bike heads that you see on the sides of the roads, and think about like that small share is making up 22% of our traffic fatalities. It's still a consistent trend. Serious injury going down, fatalities going up. We have a number of different methodologies that come out every year. I don't want to get into how the methodology is because sometimes there's a little bit of flaws in there, but it is still consistently points to Florida struggling with the safety for bicyclists and pedestrians. And with micromobility, I feel like that's probably going to fit into this category even more and potentially get more people on the roadway. That number at 22% from 2019 to 2023 has gone up to 27%. These serious injuries are starting to level off. Technically, it's lower than it was in 2019, but you can see the trends starting to go back up. So our snapshot at 2019 or snapshot at 2023, it's very similar. There's not a lot of difference in the trend. Like I said, the trend's not good. Fatalities have leveled off, but they're still a good bit higher. It's something that as a state, the trends aren't quite going where we want them to. I will say there is a little bit of good news in this in the sense that the population has grown so much in Florida in recent years that if you did a crash rate analysis instead of a total crash analysis, the crash rates are dropping. And if you're not familiar with that, these are total crashes. This is just a sum of the crashes that happened. Whereas the crash rate is saying, let's take population or let's take AADT and divide by the number of crashes to say, get the crash rate, which is crashes per person or crashes per AADT, or even crashes per lane mile is a popular one as well, right? Because more people on the road means there's more exposure, and you would predict the crashes to increase. So even though it is increasing, we want to reverse it. There is some heart in the fact that we are also holding the line to some extent because the crash rate is going down. So looking, Greg, we'll get to questions in just a second. Looking at some of the identified countermeasures, refuge islands, walkways, road diets, separated bike lanes. There's a recent study that came out. I saw it a couple days ago on LinkedIn, where separated bike lanes increase safety significantly for all users. So just looking at those enhancements, those design level enhancements, and make sure we're designing for the users that are on the roadway. So largely, we've adopted Target Zero, right? That is the state's effort at addressing this. No matter what it's called, our goal is that no one dies. So this effort is not alone. There's a number of similar efforts throughout the country. Some of them have different focuses. You've got the Vision Zero effort, the Towards Zero Deaths, which is Federal Highway Administration, AASHTO, a few other state departments. You got a Road to Zero Coalition. That's the National Safety Council, US DOT. But ours is zero. And we are making sure that's not just a vision. We are going to get to zero. And one of the unique things about ours is that while we incorporate, and we'll talk about this later, we incorporate a lot of Vision Zero principles. Target Zero takes a step further because we're going to focus on user behavior as well. When we talk about that safe system, there's a number of pillars that we can affect. Safe road users, safe speeds, and safe roads are all three that we have a significant effect on. So one of the big reasons why we're targeting the fatal and serious injuries, aside from the fact that it's optimization of resources, aside from the fact that we want to make sure we're getting the worst out of the way first, right? It also changes what we're focusing on. Right, because I'll use a roundabout for an example. Years ago, there was a roundabout at Jacaranda that was in the news quite a bit for being unsafe. The department supported the locals in putting a roundabout in there because the department was trying to get roundabouts to be a little bit more popular and adopted. After the roundabout went in, there's a lot of news stories about how dangerous it was because of the crashes of the roundabout. The roundabout did increase crashes. What was interesting that we did an after study, and then we did go back and we made some changes to decrease those crashes more. But what was interesting is the fatal and severe crashes were eliminated. So in that case, if we had looked at total crashes, that may not have been a decision that we made to put that roundabout in, right? But ultimately, even though we don't want those people to be getting in crashes, the fact that we were able to make sure that people walked away from the crashes is significant. And that's one of the big differences with focusing on that fatality free is we want to make sure that we're working on the worst. So like, let's say signal timing, right? If we were timing for speed to control speeds, we've reduced speeds, we've reduced significant serious injury and fatalities and crashes. We may have, say, increased fender benders. It may be a trade-off, but that's how our decision-making changes. So I'm going to pause right there before we get to something else. Greg, I believe you had a question?
Yes, I was just going to ask, do you know what the population increase in Florida typically is?
I do not.
Okay, because again, I saw some of the increases were like less than 5%. And I just wonder, I think that's an important figure when you talk about increase and decrease of crashes.
Mm-hmm. It is. And that's one of the things we were saying, like, we want to make sure that it's not hopeless. We've at least been holding the line because there have been so many people, and the people that aren't used to Florida that are coming down.
If I can give a little bit, just did a quick Google search. Florida was the fastest growing state from 2022 to 2023 with like a 2% population growth.
Gotcha. Okay.
And it is regional as well. Like, so some of some of the worst areas when we're looking at, say, Polk, the Lakeland, Winter Haven metro area, you're looking at Sarasota, Manatee, you're looking at Fort Myers. Those are the ones I know most because used to have to deal with them. Those are some, like, where some of that growth is concentrated. Like Polk County, last year was named the fastest growing county in the country. So some of those areas where you're seeing those safety issues really pop up, there are those population growth. So there is a relationship, but it's two ideas we're trying to hold at once, right? Like, we want to make sure that those fatal and serious injuries are reduced, but we also have, not to get discouraged because we are holding the line against the population growth that we're seeing. So there's a video, getting back into why it matters. There's a video that was produced a while back that I'm going to let play. It's only a couple minutes long.
Do you know in Florida, an average of 800 pedestrians and bicyclists are fatally injured in traffic crashes every year? What do you think is a more acceptable number?
Acceptable? Maybe 50?
Okay, this is what 50 people look like.
Well, that's my family. Friends.
So now, what do you think is a more acceptable number?
0. Definitely 0.
All right. So I've heard this before, right? That there's an inevitability to traffic crashes. It's going to happen. But I think when we start looking at what that actually means and the fact that we know that we can reduce, if not completely prevent them, and we'll get toward that at the end of the presentation. I feel like a moral imperative, right? Especially as professionals. If we have the ability to impact something positively like this, to prevent those fatal and serious injury, fatalities and serious injuries, there's a moral imperative to doing it. It may have not affected us yet, but in all likelihood, either we or somebody that's important to us will at some point in their lives be in a bad traffic crash. It's something that we should be taking seriously. Because one day it may be our family. When we talk about what is acceptable, like I said earlier, there's 36 people in this room. 8 of us 8 people die a day and 46 people are seriously injured. That would be this entire room plus more today would be in the hospital. So we want to look at, like, what would that look like, right? We have certain design paradigms or certain things that we see in society of like, hey, this is the way things should be, right? We want to think about what that would look like. I was with the department when we started talking, introduced context classifications, right? When we started saying, hey, it's not just about the roadway. We really need to make sure officially that we're paying attention to the areas surrounding the roadway, and that changed that paradigm on its head. We've introduced the idea of target speed in the department, the idea that yes, we can control speeds, and we should be figuring out what's a safe speed for the users and the context in that area, and then setting the roadway that. We shouldn't necessarily be letting people decide. We should be deciding through design. Acknowledging that they are preventable. Even when it's kind of going back to like the DUI conversation, we don't have perfect people, and we hear that a lot about. You know, I used to hear this one phrase. The most dangerous thing about driving is to loosen up behind the wheel. The idea that everything is completely safe, it's perfect, but it's just the person that's wrong, right? And going back to those industrial engineering ideas, even the people that make really dumb decisions, they're not always bad people. People are flawed sometimes, right? Whether they're influenced by something, whether it's just they're not thinking in the moment. I don't have a lot of tolerance for DUI, but at the same time, it doesn't mean that someone that is involved with that is necessarily evil. It's just there's something that happened at that time that led them to that decision, right? Road users overestimate their abilities. People in perfectly good mental health assume that they can handle more than they can. There's an idea that we design for a fantasy user sometimes. So like we have design vehicles that we're designing for. We should also be designing for our users. And when we say, for instance, like a mid-block crossing, right? Let's look at that. We have certain standards for where a mid-block crossing goes. It needs to be so many 100 feet from here. It needs to be so many 100 feet from here. This is what you need. But the fact is the pedestrian is going to cross largely where the pedestrian is going to cross. So we're not designing necessarily for the user that we have. We're designing for someone that we would like to have. Something else to consider with that is making sure that when they make those mistakes, there's some level of forgiveness as well. We've all probably remember when we started driving, or if we have children that are, say, teenagers, knowing what they're doing when they start driving, or if you don't have them that much. My kids are 5 and 6, so being able to watch them and their decision-making skills and understand that they're not perfect in their decision-making, but it doesn't mean that it shouldn't be a case of they made that decision, therefore it's okay if they die, right? We want to make sure we're preventing that. So how do we reach zero? Like I said before, it requires a paradigm shift in how we perceive it and how we approach it. We shouldn't accept that it's a price for mobility. And when we start getting into, say, Vision Zero and the safe system approach, it's grounded in an ethical imperative that no one will be killed or injured when using the roadway system. So we'll talk about this more on others. I want to be clear, like you'll see this again, but I want to talk about how Vision Zero is a part of Target Zero and how some of those ideas, right? Vision Zero sets a goal of zero while still maintaining mobility. It acknowledges that traffic deaths are preventable and that human behavior influences crashes and how we approach that. It's a multidisciplinary approach. Target Zero is that effort that plans programs and projects, both infrastructure and behavioral, to help achieve that goal. The big difference between the traditional approach and this approach, the traditional approach, there was an assumption that traffic deaths are inevitable. We're saying that they're preventable when we are operating under that belief. It's looking at perfect human behavior. Essentially, we're going to design for the physics of driving, right? Like our super elevation on our curve and our horizontal curvature is designed for what physically keeps the car on the road for the design speed. We're assuming that people are going to obey all the traffic control devices, but we know that they're not. So how do we integrate human failing into that approach? We were looking at preventing collisions versus preventing fatal and severe crashes. We were looking at an individual responsibility on the drivers. Like essentially, we've provided a safe roadway. There's nothing that's inherently wrong with it. Therefore, if you're not using it correctly, you're going to suffer the consequences. Where instead, we're going to be looking at a systems approach. We want to make sure that all of our systems in place, there's multiple systems in place to catch somebody if that mistake, when that mistake happens. And saving lives is expensive versus it not necessarily being expensive. Sometimes it's just doing it differently. So I'm going to take a break there and ask for any questions. Station. Okay. So there's I'm gonna kick this off by hitting it on the chin. There's a big statistic that's out there, and that's 94% of crashes are directly linked to human behavior. This is a NHTSA quote. I see this quoted a lot, right? It's we can't do anything about crashes with infrastructure because it's all human behavior. This is NHTSA's clarification. The critical reason is the immediate reason for the critical pre-crash event and is often the last failure in the causal chain of events leading up to the crash. Although the critical reason is an important part of the description of the events leading up to the crash, it is not intended to be interpreted as the cause of the crash, nor as the assignment of the fault to the driver, vehicle, or environment. So let's say, we're going to dive into this, but let's give a situation. Let's say someone misjudges a gap, turns faster than they should, and hits a pedestrian in a crosswalk. That is a human error, right? That gap was misjudged. They didn't look to see the pedestrian. But if we look at the chain of events leading up to it, let's say they're driving on the roadway and they're entering an urbanized area. Is there any transition zone? Is the roadway designed for an appropriate speed leading up to it, right? Because as you decrease speed, you decrease the chances that it will be a fatality. You also give the driver more time to react to decisions. So have we done that, right? Is the radius of the turn. So maybe we should have done centerline hardening, pushing it out so that there's it's that turn is less of a nice gentle radius and more of a hard 90 degrees to get down to get onto the side street. That could have prevented it. Signal phasing, would that have worked? You know, if we're looking at multiple lanes of traffic, should we have used protected phasing instead of permissive phasing? Speed of oncoming traffic, was it appropriate? Should we have used an LPI to get the pedestrian out there through the crosswalk before the guy was turning, right? So there's a number of events that could have happened to make sure that that fatality didn't happen. So even though that last issue is a driver error, there's a number of things that we could have done leading up to that event that could have helped prevent that. So the questions we should be asking is, you know, would they have made the same decision if they were going slower? Would separated facilities or different facilities would have protected the pedestrian from the driver? If the left turns, the signal were protected. Would the driver have made that turn? If it's a nighttime crash, would lighting have made a difference? Recently, we did in District 1 LED retrofits, and going back and getting rid of high pressure sodium and putting LEDs. There's a pretty significant decrease in crashes just from that. You know, so even if seeing if the lighting is sufficient. So getting into the NHTSA stuff again, that big blue piece of the pie is where driver behavior is a contributing factor. But when we break that down, we're looking at recognition error. So drivers and attention. And that could be, hey, maybe they're distracted driving. It could also be, maybe we don't have proper wayfinding. Maybe there's not, You know, maybe it's a marked crosswalk, but there's not an RFB, there's not a PHB, there's not a mid-block pedestrian signal. There could be other distractions, decision errors, driving too fast for the conditions, too fast for the curve, false assumptions of others' actions, illegal maneuvers. And while these are all technically on the driver, they're also things that we can affect. So one of the things we're talking about future lessons is thinking through the decision-making process and how we can help that decision-making process for a driver. There are things that we can do, whether it's improving the information they have, whether it's reducing the amount of information that they need to make a good decision, whether it's giving them more time or space to make those decisions by slowing speed, or like in a medium project, separating conflict points, looking at performance errors, non-performance errors, and other driver errors. So when we break this down, even though that statistic is out there and is very often misquoted to say that, you know, we don't have responsibility on the infrastructure side, it's not true. NHTSA has addressed it itself. And ultimately, when it gets down to it, we can and do have an effect on that decision-making process of the drivers. So since that was kind of a big one, and sometimes it's contrary to what we've heard, I wanted to take a pause there and see if there's anything that someone would like to ask or discuss on that idea.
I had a quick question.
Yeah.
Yeah, you talked about, I think it was a little bit early on, so apologies, but how the severe crashes went up, but or no, I'm sorry, the severe crashes went down, but the deaths went up. And I was wondering, are there crashes that are considered not severe, but involve a death? Like a pedestrian crash. So I was just trying to wrap my head around how that's possible.
I think we all are. So it is, Ben, you want to get the definition and then I can get on theory later? Ben,
you're on mute, Ben.
Is that better?
Yeah.
Yeah. Any death that occurs due to injuries received in a crash when there was a motorized vehicle involved is considered a traffic fatality for study purposes. We do have incidents where someone dies, but not because of the injuries in the crash. We do have incidents where someone is killed in a crash, but the crash is on private property. And we have possibilities where somebody is seriously injured, but they live for more than 30 days. And so the death occurs after 30 days, and those are not considered traffic fatalities. So there's a handful of circumstances that would take somebody out of that pool of traffic fatalities, if that helps.
And Greg, I don't know if you were asking this, but just for clarification, the two are mutually exclusive. So if it's a fatal crash, it's not classified as a severe injury. It's classified as fatal. So it is possible that you can have, changes in those, but the total sum, like what we're seeing with those stats, is the sum of severe injuries and fatalities is going down, which is good. But for some reason, the fatalities are actually increasing while the severe injuries are decreasing.
And we're not quite sure why yet. It could be any number of reasons. At least for why, the idea of why fatalities are increasing, I think we can kind of link to certain factors. But why that inverse relationship exists, it could be like level 1 trauma centers are big on survivability, like how quickly somebody gets to it, right? There's been medical knowledge shared, so it could be improvements in vehicle safety. Like introducing seatbelts was huge. Like right now, statewide, Ryan, correct me if I'm wrong, but I remember from Porna's analysis, it was 40% of fatalities in Florida weren't wearing their seatbelts.
That was specific to the lane departure emphasis area. You had like almost half of lane departure fatalities involved occupants who were not belted, which is insanely high number. So if that was a change in behavior, you would see a significant reduction in those types of fatalities.
So vehicle design could be contributing to both sides. You know, like the larger vehicles could be contributing to more fatalities, but also safer vehicle design could mean that, you know, when some people are hit, maybe it results, they've got a nice crumple zone and it doesn't quite go that far. Lori?
So is there a chance, well, I don't know, you may have already analyzed this, but if the increase in serious injuries is based on, in part, by people surviving over 30 days and then dying afterwards, or could it be that someone's in a serious injury and then is visiting and then gets, I don't know how often somebody gets transferred to a hospital out of state, but would that still be considered, if somebody dies out of state after a crash within or without, like, let's say 35 days or in 29 days, would that be considered a fatality from Florida's perspective?
I believe once a fatality occurs, it turns into, and Ben, jump in if I'm wrong, but it turns into a traffic homicide investigation, I believe. And they're going to follow, no matter what hospital it is, they're going to, I believe, follow up to make sure that it's recorded.
The procedure for the officers, for this law enforcement, is something along those lines. When they think somebody may die, or when they discover that they have died due to injuries in the crash, they would involve traffic homicide to follow up with an investigation to document all the details correctly. But from an administrative perspective, if they died after 30 days, we wouldn't count it as a traffic fatality. It would be counted as a severe injury crash, assuming the injuries were severe enough to send them to the hospital to begin with, but it wouldn't make it into the fatality total if it was after 30 days.
So it could it also be then improved, I think you said that, improved medical care or response times, potentially?
I think if it was, so we were throwing that out as just being different options, but I think if it was specifically that, I think what you would see is a decrease in fatalities, but an increase in serious injury.
Yep.
I think it boils down to with that, like, we're not sure, at least currently. It could be anything. I mean, it could be one of those things where it's a threshold where we're very successful at this level, but at this level, it's going to be a fatality anyway. We're not. It's something we just want to make people aware of, because while the total crash numbers, like Ryan said, are starting to drop, we still need to acknowledge that there is a problem as fatalities are still climbing.
And I think, you know, you're going to get into the pillars of the safe system in a bit, but the post crash care, you know, is one of those things, and that's really how we're addressing a crash after it occurs, right? How we're trying to save that life if it was a severe crash. A lot of the things that we focus on as a department is going to be on the proactive side of trying to keep that crash from occurring through design, through safe road users. So
there is one thing that is interesting about the department too is the coalitions also are multidisciplinary. So 100% we are focused on like safe roads, safe speeds. With Target Zero, we're focused on safe road users. But the other part is, you know, safe vehicles and post-crash care. So there is some interaction with vehicles. I haven't seen Florida do it a ton, but like with SunTrax, you've got a lot of stuff going on. I believe they just made another rule requiring automakers by 2030 to have emergency braking, detection of pedestrians with emergency braking in all vehicles. You think about like seatbelt laws, there's different crash standards. Like we have certain crash standards in America, but then like Europe has actually pedestrian crash standards where, say, you know, if there's, I think one of the crashes, it has to hit the hood, and there's a certain amount of deflection of the hood has to have before it hits like a hard point, like the motor or motor mounts. But we do actually work some with post-crash care. We don't affect it in the terms of like we specifically get our hands dirty doing it, but I'm thinking specifically of the Bike Ped Coalition. They have an EMS. We have an EMS focus group, and what they're doing is they work with the state to look at what crashes are specifically happening there. So it's not just other, because the medical community has a lot of issues to worry about, right? So they act kind of as our advocates and leaders in that industry to start disseminating best practices. Like, for instance, we saw a presentation a few months ago where they were talking about the injury patterns of pedestrians getting hit have changed. Where before you'd have a lower extremity hit, and then the head hit with the person essentially folding over the hood of the vehicle was the fatality. Whereas right now, the fatality is either blunt force trauma to the chest, the thoracic area, or a head injury from the pavement, because the vehicles have gotten much taller. Instead of hitting the pedestrian lower and then folding, they're hitting full on to the pedestrian, throwing them, and then usually the final action is when their head hits the pavement after being thrown. So because of those things, sometimes how you treat the crash changes. So we do work with those representatives to help disseminate through Florida I guess we call it cutting edge trauma information, to make sure that the hospitals and the traumas and the emergency rooms are operating under what we currently know is going on versus what we used to know is going on. Good conversation. So, quick primer on the safe system approach. I assume most of you have heard this before. It's a global movement that has been in place in countries across the globe for more than 30 years. FHWA's top priority is safety, as well as FDOT's. And for this reason, it supports the vision of zero deaths and serious injuries in the nation's roadway system. While the safe system is being introduced to the United States, it's worth mentioning that it has been around the world, right? It's that holistic approach to preventing deaths. So it's built around safe roads, safe speeds, safe road users, post-crash care, and safe vehicles. Preventing serious injury and fatal crashes is everyone's responsibility. Safe speeds is just that. It's making sure that the speeds are appropriate for the area and the roadway that you're in and the users that are present. It doesn't really matter what we would like speeds to be. What matters is what the safe speed is for where you are at. Safe road user, and that's where like our target speed, the FDOT's target speed procedure is coming in, where you're identifying it and you're identifying the changes in the roadway that need to be made to get to that speed. Safe road users, largely heavily based in education, making sure that people are following the rules of the road, doing what they need to do. Personal view is kind of like Excel, where when we build the roadway correctly, that's like having macros and functions in your Excel sheet. So you just put your input in and it works for you. Safe road users is like having to manually input the information every time and do the calculations yourself, right? It is definitely a pillar, but it's probably one of the harder ones to make progress in. Post-crash care, making sure that we have the best, we know what the best treatments are, making sure that our response times are quick and that we have the facilities nearby to be able to get them. One of the biggest predictors of a serious injury versus a fatality is how quickly you can get someone to a level 1 trauma center. That is very critical. Safe vehicles, auto industry, we can help with that. We can help inform it. But whether it's seat belts, whether it's lane assist, whether it's emergency braking, whether it's different crash standards, those are the ones that safe vehicles are going to help us out with. And then safe roads is squarely in our court, right? Safe roads and safe speeds is what we are doing. So the big principle behind this, and this it ties into the other ideas we're talking about, right? Like the target zero, vision zero ideas, is that we are accommodating human mistakes. We are no longer saying that if people would stop making mistakes, that this wouldn't happen. We need to acknowledge that people make mistakes. I'm sure all of us in this call in the last 30 days had that kind of, ooh, I should have done that moment at some point while we were driving, right? We didn't turn soon enough. Whatever happened. And then we want to keep the impacts of the human body at tolerable levels. So once again, it's the idea that just because you make a mistake on the road doesn't mean you deserve to die. So how do we reduce those penalties and keep people from dying or having that life-altering injury when the crash happens? After adoption, Sweden looked at a 60-70% reduction in fatalities countrywide. The Netherlands experienced 50-60%, Australia 50-60%, New Zealand 50-60% reduction in fatalities. This is years ago. You can see this is 94 to 2015. We're still making progress. We still have more knowledge. There's new intersection ways. There's new ideas of thinking that are coming out. I think that the idea behind it, though, is they decided that they were going to make a change, and they did it. And once they started making those decisions and prioritizing safety, things started changing for them. It's not a new concept, and it's been very successful. We can argue whether it's applicable here or not, but when we look at places, say like Australia, right? They have rural, they have urban areas. There's different cultures everywhere, and we are consistently seeing that no matter what, when they start applying these ideas, that it is successful. This is just the graphical overview, like pounding the idea in. Death and serious injury is unacceptable. Humans make mistakes. Humans are vulnerable. We're squishy. It doesn't take a lot for us to get hurt. Responsibility is shared, safety is proactive, and redundancy is crucial. And then we have those, safe road users, safe vehicles, safe speeds, safe roads, and post-crash care as the main pillars of what we're focusing on. So death and serious injury is unacceptable. That's the first principle. We don't want any crashes to happen, but the safe system approach prioritizes crashes that result in death and serious injuries. Why? Because they're life-altering. If you're dealing with an amputation, if you're dealing with being paralyzed, whatever it is, those are the life-altering crashes. They're the ones that we don't walk away from. They're the ones that your life or your family's life is affected forever in a negative way, and you have to adapt around that. And fatality is kind of self-explanatory, right? Like we want to make sure that we're going home. The goal is to modify how the users, vehicles, transportation infrastructure, emergency responses, all of it operate to reduce the likelihood that these crashes happen. And when they do, reduce the consequences, right? There's a number of graphics we'll see in the speed calming module, where just reducing, say, 10 miles an hour can make a significant increase in survivability of a crash. And this is the big one that I think is kind of hard to get over sometimes, and that's the humans make mistakes. We've seen people run across the road. We've probably all done it ourselves. I don't know if anyone's been to a district to be unnamed that I worked for, but we talk about people crossing the road and how people need to cross at the crosswalks. But then every day at lunch, you see everyone walking across railroad tracks to Sonny's or across the roadway to get to Publix, right? We do it. We're guilty of it ourselves. So what's the saying? If you point a finger, 3 fingers are pointing back at you. But it's the idea that we are going to make mistakes, and we can't design a roadway system that is intolerant of those mistakes if we're going to be successful. There are ways to do it, but there are decisions to make. There are trade-offs, right? And that's where when we say we're going to prioritize safety, we're going to prioritize accommodating those mistakes, not encouraging. And we can work at reducing the mistakes, but we're still going to make it to where we're acknowledging that they're happening and reducing the consequences, which leads into them being vulnerable. It doesn't take a lot to hurt a human. We have a very limited ability to tolerate crash impacts before death and serious injuries. It's one of the central approaches to the safe system approach. We want to manage the kinetic energy transfer to limits that are survivable. So that could be reducing speeds. That could be changing conflict points. We're going to talk about conflict points. If you don't know what it is where two or more vehicles or users can legally be, but not physically be at the same time with a conflict, right? So a crosswalk is an example of having multiple conflict points. If you have someone turning right onto a side street, they're going to cross the crosswalk in the exact same place that someone using the crosswalk will cross, right? That is a conflict point. So one of the things we can do in addition to lowering speeds is change the conflict points and the type to a different type that's less severe. Access management is a good example of this. We're changing an angle crash or a T-bone to a side swipe or rear end as people are doing their U-turns or turning right and going out. That helps as well. Responsibility is shared. Everyone has a role. As we talked about earlier, even in the department, it's not just the safety group. It's not just the design group. It's not just an operations center. There are pieces of this for everyone, and everyone paying attention on it. That idea of, if you see something, say something type deal. We're all a part of the solution, whether it's the consultant side, department side, local government, and making sure that these things happen. And that we are getting to that target zero goal. And it's being proactive, right? Sometimes it's difficult to fund things without historical crash patterns, but when we can, we need to be making sure that they don't happen. So the idea of future-proofing designs, understanding that more development will occur, there will be more traffic, there are other road users. So whether it's a significant number of users, let's say pedestrians, the fact that any exist mean that they need to be accommodated. So looking at those risks and mitigating them, Central Office has recently done, and we'll talk about it in those modules, has recently done a root cause analysis for lane departure and bike ped crashes, so that we can start looking at where those risk factors are in our designs and our roadways, and making sure that we're putting the design features in before the crashes show up. If we're in PD&E, making sure we're using a predictive method and we're using it well to make sure that we're planning roadways that are going to be successful at more than just moving people from point A to point B, but also moving them safely. And then redundancy is crucial. Making sure that throughout the whole system, we have the redundancy. And even if we only look at if we look at the things that we are mostly responsible for, the safe roads and safe speeds, making sure the speeds are there. If we're looking at, say, pedestrian safety at an intersection, do we have protected phasing? Do we have flashing yellow omit? Do we have an LPI? Do we have shorter crossing distances? Are we controlling speeds in the corridor? There's a number of things that we can do aside from just one that sets up a system of things that have to fail before a fatality occurs, right? Because a lot of times we can have multiple. If we have a whole system, we can have multiple failures, but as long as the last few catch you, you're still good. Just a reminder, and then going into that idea of having this system. It's like a good example is Swiss cheese, right? Layered safety would be the slices of cheese. The holes would be the weaknesses in the individual parts of the system. They are weaknesses causing failures or a latent condition, and they act as successive layers of defense. So if you have all the holes light up, a person's not protected, and that's when you're going to get the fatal and serious injury crashes. The idea is to keep those holes from lining up. We want to make sure that system's in place so that if any of the particular elements fail, that a person will be protected. And as a reminder, we're going from preventing crashes to preventing death and serious injury. And I know I'm doing a lot of repeating. It's on purpose. It's for a reason. We want to make sure that these ideas stick with you while we get through the rest of the modules. The idea is, human behavior, whereas now we're going to be looking at designing for human mistakes and limitations. Controlling speeding, it's like looking at law enforcement as an approach. Well, we can't control law enforcement funding. We can't control their activities. And that's also kind of looking at a symptom. Let's look at the cure. So reducing system kinetic energy, making smaller radiuses, making where people naturally go slower. We want to make sure that it's not just speeding over the speed limit. We want to make sure that speeds total are lowered. Individuals' responsibility to drive correctly versus we all have a responsibility in this. And we do. We can prove that we are effective when we make decisions prioritizing safety. And if we can prove it and we know that it happens, we have a responsibility to make those decisions in the future. And then reacting on crash history versus proactively identifying and addressing risks. That doesn't mean we shouldn't react to crash history, but it does mean that it's not the only thing. It's not a case of let's do this and when crashes happen, we'll prevent them. It's a let's make sure those crashes don't happen in the first place. We all have that role. Like if there's one thing that I can get through in this conversation is understanding that not only is it important to focus on this, but that we are all responsible. Every one of us in our jobs are responsible for advocating and making sure that it's safe. As a consultant, if I'm working on a project, I should be advocating. I should be making sure my designs are safe, and then advocating to the department or to my client, making sure that hey, look, like this is what we're seeing. Let's do this. This is why we're doing it. Building the argument for it, making it easy. We are not going to get to zero if we don't focus on prioritizing preventing those crashes. So if you want more safe system material, some additional reading, while if you get through the strategic highway safety plan, if you want some more cozy reading, FHWA has plenty of it. I'll leave that there for the future. And before I get to the wrap up, I wanted to stop there real quick for any questions on that section. I know it was a bit of a bruiser. Okay. So I want to get in a little bit to what the state is doing. Obviously, we have our strategic highway safety plan.
You do have one question
there.
There
we go. Lois?
As you were talking, it made me think of the community traffic safety teams and safe system approach, bringing the various perspectives. I would imagine is this something that's being furthered through those teams and those particular partnerships?
Yes. I'm gonna a two-part answer. So whether law enforcement knows that they're being a part of it or accepts that they're being a part of it, like they have it's kind of like the post-crash care, right? They're still their own entity. They are partnering with the department on it very significantly. And they do, everyone that I've worked with has had a desire to make a difference. So that is one of the ways in the CTSTs that, and everyone operates their CTSTs a little bit differently, but largely being able to bring projects to law enforcement or work with them on initiatives to be able to bring them into projects. I know there's a number of districts that have worked on, I mean, you all have the high visibility enforcement. Construction has a hire back program where they can put officers on construction projects to help with work zone safety. Any designer really, I haven't seen a CTST coordinator yet that has been unwilling to let a designer come out and talk to law enforcement in the CTSTs. And then law enforcement also brings issues that they notice because they are on the road every day. A lot of times they bring issues that they notice to the coordinators, and the coordinators start working through the department to try to fix them as well. Did that answer your question?
Yeah, I just think
okay.
Just understanding the various components and, like you say, everyone can contribute and how. Yeah.
Okay. So we have the Florida Strategic Highway Safety Plan we covered. It's laying the groundwork and the framework for how we move forward and address safety across the state. We have the DOT compass. Like I said, communities are at the center, but safety is at the top. And safety supports communities, right? Wanting to make sure that we have healthy people where they live. One of the things I would say, like, treat it like it's the road in front of your house. How would you want people acting? So what else is the state doing? We've got Target Zero. Ben Jacobs, a huge shout out to Ben. Ben has done a ton of work with crash data over the years, getting things to be very accessible and open. We just did the migration from CARTA Signal 4, which I feel like is democratizing that crash data a lot more. It's a much more user-friendly interface and drops the barrier to entry on it quite a bit. We've done root cause analysis. We've done outreach campaigns, very, very new, large, cutting edge outreach campaigns for aggressive driving, not just informational, but actually getting into to really deep behavior change approaches. Outreach to children. One of the things we've got is the Guardians to Safety comic. We are constantly looking at updates to the FDM, incorporating new guidance, incorporating, we've seen recently guidance with 3R projects we'll talk about. We've seen target speed, we've seen speed management guidance. There's always something that's being looked at and discussed to be able to take our design standards further in accommodating safety. Updates to the TEM, working with doing crosswalks. Right now we've got a request to experiment with mid-block pedestrian signals. So if you can warrant a PHB, then there is an opportunity to put it in a mid-block pedestrian signal as well instead of the PHB. We've done things where we've went from the like say crosswalk warrants, certain contexts automatically get a crosswalk, and then you're determining like what to do with the crosswalk after that. Context classification. I know context classification isn't new, but it's big. That context classification has fundamentally changed how we look at design and how we make decisions in different areas in the roadway and operations. Target speeds is huge. Being able to say that, hey, not just do our 85th percentile, but to see what people are driving, because we used to have our design speed, and then a lot of times we'd post the speed a little bit under design speed just to accommodate people going over, but then people drive faster, and then as they iteratively drive faster, we increase speeds, it starts climbing. So we've started saying, hey, what's a safe speed? What do we want people to go, and let's start moving our design to make them go that speed. The 3R process, and I know there's been some with budgets, it's moved around a little bit, but making a decision that we are going to look at safety in every project. Updating the speed zoning manual. We're introducing the 50th percentile. You don't have to use the 85th percentile anymore. Being able to use the 50th percentile, and even the safety academy. The idea that it's no longer Tracy and her small group that has responsible for everything going on. Like we said earlier, safety does outreach and education, and they manage the HSIP funds. And then different districts have different flavors of what else they're responsible for, but ultimately everyone is responsible for making safety decisions on their project. And that's the goal of this, right, is making sure we can all do that analysis. So just talking a little bit more about the 3R program, it's big, making sure that we are not just saying that we're about safety, but that we are changing how we do business to make sure we're addressing it. The next slide, I got two more slides that I really want to get in, and I'm going to preface them before I do them. And this is how we're going to close this out, right? We talked a little bit about the doom and gloom about how bad it is and we need to get there. And then the question is, can we, right? So most of you probably haven't seen this, but this year we've gone through and looked at safety funded projects historically in the work program. And the reason why we're looking at safety funded projects is because we know that those projects were completely safety focused, right? If we grab other projects, they may not have been, it may have been a secondary goal, but we know that these are focused, and we're trying to answer the question of, are we making an impact, right? We saw the statistics, fatalities are still climbing. So are we making a difference? Can we make a difference? Responsibility is shared, it's nice to say, but can we actually do something? And the answer is yes. So this is looking at fiscal years 2016 and 2019. So what we did is we looked at the projects that had the funding on it, and we looked at year of construction. And we compared the crashes on that project before construction and after construction. So statewide, on safety projects, there was a 20% decrease in fatal and serious injury crashes. That's 800 people that were not affected, right? And then a benefit cost ratio of over 24. To me, this is pretty good. It's, we're still not at the 50 to 60% range, but we're also like, these projects could be anything. It could be lighting only, right? It may not have been a holistic design of the corridor based by the safe systems approach. And our safety has become iterative as our understanding changes. So honestly, in terms of being able to show hard, fast numbers, this is really, really good. And to me, it shows that when we make it a priority, we will make a change. There will be positive changes. And if we drill down a little bit more, District 4 has been doing really well. So your benefit cost ratio is over a 64, 19% reduction in fatal and serious injury crashes, which translates to 186 people that got to walk away from that crash. Think about how many people that is, right? I don't know how many people is in your district headquarters. I want to say there's around 400 people in total in District 1, somewhere around that. It's 400 to 500. That's almost, that's getting to a third to a half of the people that populated that, right? That's significant. So great job, District 4. Tracy, looking at you. I don't know if it was fit in your tenure, but you guys are doing great. So imagine if we take these statistics, right? We take this focus on safety and what we know now, because these are older crashes, right? This is before we really started getting into complete streets projects hitting, before ICE really started hitting, before we started doing target speeds, before we had context classifications. This is before all of that, and we're already doing this good. Think about what we're going to see now when we start applying all of those concepts into our projects and the difference that we're going to make. So when we answer that question of if we're personally responsible for significantly reducing or preventing all fatal and serious injury crashes in 5 years and 10 years and 15 years, what would we do? We have answers. We have answers, and we have a possibility. We have an opportunity to actually make that happen, right? Because we are creating an organization full of safety experts, and you're the first people, right? So ultimately, now that you have the knowledge, and that's the key, right? As professionals, if you have the knowledge that what you do makes an impact, then you have the responsibility for that impact. We all have that responsibility. We can do it. And our call to action is zero. Like it truly is zero. It is unacceptable to have fatalities and serious injuries on our roadways. We need to be doing what we can. Our families are on it. The people that we care about are on it. We are on it. I don't want to see, when my children start driving, I don't want to see them involved in anything like this. I want to make sure the roadways are safe for them. This is an aspirational goal. It is aspirational. It's going to take a lot of hard work, but it's not an impossible goal. We know we can make a difference. And even if we don't get to zero tomorrow, if we don't get to zero next year, what we're doing today is going to have significant impacts in the future. So I appreciate you sitting through all that. I know presentations like this can sometimes be a bit to sit through, but I definitely appreciate it. I would like to open up for any final questions at the end of it, though. We've got about 25 minutes before the next one starts. So you'll have a little bit of a break, but this is a good time to ask questions.
We just had one thing in the chat about adding the Florida Transportation Plan to the list of things Florida is doing for safety. I think reading up on it, that makes sense. So we can include that as a revision.
Absolutely. And then I think I saw Billy raise his hand.
Exactly, something along the lines of that. I know you guys have a lot of tracking tools that are being used currently to see like safety implementations. I'm not sure if there's like a vision in the future for like, common incidences like we have like safety implementations in different districts that we could share like this, statewide. So people are aware of like specific to pedestrian crashes because of vertical geometry, like what another county implemented.
I don't think we have anything like that statewide. What we do get is that there is an intent to do that with the DSC, DSA meetings. So there is a sharing of knowledge there that I would hope would be disseminated, but I don't think there is anything currently, any physical infrastructure that is tracking that yet. There is, Will Watts is doing a project to start tracking, I believe it's countermeasures and projects, but I know that doesn't completely get the scope of what you're talking about. But there is some effort, but there is not currently exactly what you're talking about, which is I think kind of like a best practices. This has been effective right here.
And so thank you.
Absolutely. Lori?
Thank you. I think it may be more of a comment. I did value engineering for the first time last week, and it was amazing. I learned so much. One thing, Katie McLean's the value engineering coordinator, we added to the template a safety, like we looked at mainland operations, local operations, and one thing that the group added was safety. And I've realized how much, like in that process, we're making decisions like how to improve this project. So it was, I wonder if other districts are adding in safety in their value engineering, or they already do. I thought it was a great opportunity, and definitely this academy is going to help in future value engineering. I think just having more safety experts.
Yeah, that's awesome. I think like Billy pointed out, there'd be a lot of value in being able to share that around. Jose?
Yeah, thanks, Nathan. You briefly touched up on traffic crashes that are life-altering, so not necessarily causing a fatality, but I guess, for example, if the victim of the crash suffered paralysis or would need like an amputation as a result. So how is that factored into, I guess, safety analyses? Is that treated similarly to a fatality where this shouldn't be happening in traffic crashes?
Yes, those fall under severe injury or serious injury. There's Ben, would you mind getting into the delineation between like injuries, severe injury, stuff like that?
Yeah, that's an interesting problem. It's the assessment of the office. It's the officer's assessment of the degree of injury at the time of crash, based on the values on the crash report, which is just traffic fatal or fatal within 30 days. It doesn't even say, it says incapacitating injury, non-incapacitating injury, possible injury, or none, or non-traffic fatality. So they select from those values, and they're not medical professionals. So the record we have is, officer's assessment, and they get some training on that, but it's not a rigorous medical assessment of injury. And we are hoping at some point in the future to come back with some post-processing and get Department of Health information to add to the crash record to give us a more accurate injury assessment. But currently we're just running things based off the officer's initial assessment right there. And so the equivalent of serious injury in all the NHTSA definitions is the incapacitating injury on our form. They line up pretty closely. Yeah. And does that answer the question?
Yeah, thank you.
And just to add a little bit to that, if somebody is needing medical transport, usually that's going to be classified as an incapacitating event. If they have a broken limb, incapacitating event. So those are the types of things that will get classified in. I posted the CAPCO crash severity definitions in the chat. So the A is the incapacitating injury, or what we refer to as serious injuries. And they usually include those things. The example that you gave where paralysis is involved would definitely be classified as an incapacitating injury.
And then we will be sharing these presentations, correct? The recordings and the slide decks themselves.
It should be. We are working with Katie and with Brenda to figure out where they're going to be hosted, I believe.
Okay. Yep, that's just a chat question.
And any other final questions? All right. Oh, Carla.
Good morning. Just to kind of narrow down, because when I did a crash analysis or pull crash analysis data, why are, let's say, pedestrians or cars being hit by Brightline trains, specifically Brightline, because that was the encounter that I had. Why are those classified as a non-traffic fatality or a non-traffic crash?
Ben, you want to handle that one?
Say that.
You-
So this is what impacts with trains. Oh, I understand why that is. It depends on the situation. Sometimes we might need a little more detail on this, but train in the current crash report form, a train is not considered a motor vehicle, which is kind of silly since it is a giant motor, but they don't consider it a motor vehicle. So like a train versus pedestrian crash would not be reported on a Florida traffic crash report form and doesn't make it into our database. It does make it into the rail safety, where the rail collects their own safety measures, but it doesn't become a traffic crash unless it involves a vehicle, a motorized vehicle like a car. So what is the particular question or concern?
Well, no, I just wanted to get clarification on why that was, but you answered that. Thank you.
Okay.
Lori?
Maybe I'll talk about this in involving trends, but I was thinking for an e-bike, are those considered motor vehicles?
That's an interesting question. And I believe they have been working, that falls under micromobility, I believe. And they have recently worked on a definition of micromobility to be for lawmaking purposes in the Bike Ped Coalition. So we don't know if they will change that definition. So I think the right answer is stay tuned.
I can add to that on the current crash report form, it's vague. There is a occupant of a non-motor vehicle transportation device option for non-motorists, but I'm not sure that the training is consistent across the state for the officers who are filling it out. So it's a little bit hard to track where those things are going.
The Motorcycle Safety Coalition, I don't know, maybe 4 or 5 years ago, produced a flyer for law enforcement where they tried to categorize every different small vehicle that had some sort of a motor on it. And I think that has helped some with that crash, like the crash form issue that Ben was talking about. But there should be, because it's becoming so prevalent, there should be at some point a definition. It's just it's a hard to define. Everybody has very strong opinions about which one's which and where they belong. And stay tuned.